are not the same. Good morning. Welcome to the Medicare Cafe pre-chat. You're joined by me and my host today, Benjamin.
I've been upgraded. I'm a host now?
You're a host. Yeah, you're a co-host. At what point... Okay, I have a lot of questions of transitional style questions, which has nothing to do...
Let's do it live. I'm ready.
Do it live. We've talked about some of these a lot, right? Like transitional questions. First of all, this is the Medicare Cafe pre-chat. Where we just kind of get on here, talk about some chaos. Sometimes we update you on our lives, or sometimes we just ask any questions that you're burning to get answered. If you are watching the recorded version, never mind, no, Olivia, no, we're mature today. If you are watching the recorded version, you just want the good deets of what's going on in our industry, which is today's topic. What's going on?
What's going on?
Thank you. I don't think that was...
Wait, what?
I said, hey, what's going on? What song were you singing?
The Motown?
And I said, hey, yeah, yeah.
I didn't realize how many different hey, what's going on songs. It's like, what's going on? The little Motown? No?
No, this was, I don't know who sings the song. This is not my job to know who sings the song, but it's and I said, hey.
Oh, okay.
What's going on?
I do know that one too.
And I said, hey, yeah, 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 yeah.
It's like the He-Man meme or whatever.
We are not the same age group. I've had to say this like 3 times in the 3 minutes I've been sitting next to you.
I mean, you know.
Okay. Anyway.
4 non-blondes, maybe. Wait, are we 4 non-blondes? We're only 2, and we're kind of blonde.
Neither of us are blonde.
I guess it's dark. I didn't realize how dark it is. Winter. That's
Winter.
crazy stuff.
Are you like a cat or like a dog? A chameleon? Who changes?
I can't see color.
That's true.
So I can't be a chameleon.
I'm not being rude. That's who sings it. What's going on? Okay.
Wait, which song though? We gave a lot of songs, and I'm sure they don't sing all of them. Sorry, go ahead.
At what point does soup become a stew? Or what time does a roux become a gravy?
Ooh. Do you want real answers, or do you want to focus Medicare today? Because I've got enough ammunition.
We still have 2 minutes. Before the Medicare. Unless anybody, again, that is my phone number right here. If you have any questions, comments, concerns, threats, or promises, or you're watching the recording version of this, you can text me, and I will read them live, or, of course, anytime as well. I try to get back to everybody within 24 hours if it's not within, if it's not during the show.
That's good service.
But when does a soup become a stew?
I think the size of the ingredients that are included into said soup/stew is what decides whether it's a soup or a stew. You disagree?
No, because I had a tortellini soup last night, and the tortellinis are pretty big and like giant things of spinach and like all that, and that is a soup.
Wait, what's a tortellini?
You married an Italian girl.
That doesn't mean I know. I don't just absorb all Italian. I don't just absorb all Italian. I do. I don't know why.
It's the cheese stuffed pasta.
Oh, so like the cheese version of ravioli.
No, you
and
want
not
cheese
fried?
in ravioli.
Is ravioli just fried?
You married an Italian person.
Yeah, and I really hope she doesn't watch the cafe.
Make your own pasta.
It's true, I do. I have an Armenian pasta maker that if I leave it plugged in for more than 20 minutes may burst into flames.
Me, you know the difference between ravioli and tortellini.
One of them includes the formuloli from SpongeBob.
We are from a different age group. I would love to hear from you guys. What is the difference? At what point does a soup become stew?
Brittany watches the cafe? Since when?
Every week she watches
She doesn't need more ammunition against me.
That's honestly so much the truth.
Okay, is it hot in here, or is it just the fact that I'm on blast?
We also have 3 heaters going at once because our studio, it is sub-zero temperatures here in Missouri.
True.
And so... we do have like this place. This is an external wall. Our studio.
Safe place.
It's not for you if you don't know what tortellini is.
It's got to be just rolled differently. I bet ravioli's 2 pastas crimped on the sides and tortellini's wrapped over and then crimped.
Almost, but I can support your improv skills. Today, guys, we're talking about what's going on in our industry throughout 2025. Obviously, we just came off of a record-breaking AEP for 2025 AEP going off these last few months. I mean, we saw changes in almost dang near every single plan. A lot of individuals shifted, moved to a med sub, moved away from a med sub. We saw a lot of changes going into this year due to the Inflation Reduction Act that is now getting put into place and being practiced through the M3P. And you guys thought, like, okay, so now let's kind of have a chill year.
Now we're done.
That's absolutely not true. This year, as we continue throughout 2025, we'll continue to see significant changes to where deft research and other professionals who study this field are expecting 2026 to be as, that said voluptuous. What's another word for tenumptuous?
Gargantuan.
It'd be a huge AEP, which is kind of like voluptuous if you think about it.
Yeah.
Let's get into it. First things first, the value-based insurance design model is to end going into 2026.
Womp, womp, womp.
So what does that mean? So keeping in mind, and I did take a bunch of notes on this because it is very confusing. What is that? Essentially, that is going to be things like travel benefits, over-the-counter medicines, different types of things like that that are reserved for individuals, not just like every type of thing. These types of benefits are reserved for individuals who can qualify them on a Medicare Advantage plan, who can qualify for them via their income or via health conditions, like on DSNPs or chronic condition plans. CMS basically spent over, I think it was $2.4 billion.
With a B?
Let me double check. Now I need to fact check myself.
That's a lot of money.
Was costing the trust fund in excess of $2 billion per year on these benefits, and we're oftentimes getting severely abused, and were the reasons why people were enrolling into certain plans. So CMS is basically saying, that's it, we're done. These plans were designed to keep people healthy and to stop like having to actually pay money on healthcare and just put it on preventative things, and it just wasn't happening. They were getting abused oftentimes. So CMS is saying, we're done. We are no longer financing these plans going into the 2026 year.
So when you say CMS is no longer financing those side, they plan to still continue, obviously, to fund the health-related benefits, but not the ones that were being maybe teetering on the edge of whether or not they were truly like a health benefit.
Exactly.
Okay.
Exactly. So what that means is, and it doesn't mean that those plans are necessarily going away. It just means, or those benefits are going away. It just means that the biggest source of funding.
Gotcha.
Because it is still in the plan's interest to still have those types of benefits.
For sure.
Because it's a huge draw. But the biggest source of funding, which was CMS, is basically saying like, nah, fam, we're done. You bad apples ruined the bunch.
So it's like the parent that said, hey, I'm going to give you money for college, and you need to put this towards tuition, finds out that you're not using it towards tuition.
I actually had a friend that did that. Went and bought books. Like, you know how expensive
like textbooks and stuff.
are.
Yeah.
Went because he dropped out of college and didn't tell his family, and his family was funding his college. So went and bought all the textbooks, put it on his family's finances, and then went and returned the textbooks and got cash. Lived off that for like 6 months.
Definitely never did that either. Oh. Hi, I am Olivia's friend.
It was me. I was Olivia's friend.
So that's interesting.
Yeah, so that's one major thing. It's just that understanding that benefits will continue to look differently. Carriers are really, I think I have that on here. Carriers are really starting to look at the chronic condition plans. Chronic condition plans, you're going to continue to hear a ton about chronic condition plans because of the change of enrollment to PD or to prescription.
Dual special needs plans.
You're going to start seeing carriers continue to put a ton of attention on chronic needs plans because of the changes of enrollment periods through the dual special needs plans. But this is something that we can expect to see take a significant impact to as well. So just know that 2026, guys, this is a significant one. It's going to be telumptuous, termaculent.
I imagine that the carriers will have a hard time trying to match the amount of funding too. So you mentioned that probably the ones that are continuing to be utilized. So it would be interesting to hear from some of the agents or so, what were some of those high value, shiny benefits that people said, oh, I always want this, and then either never used. Maybe start tracking the ones that are getting used, because I imagine those will be the ones that get invested on the carrier level instead.
Keep in mind, too, something that did happen this year, termaculent, thank you, Sadie. Something that
did
happen, it is now.
Is it a spell?
this year was that carriers now have to give reporting. I believe it's halfway through the year. It's either quarterly, but I think it's halfway through the year that carriers now have to give reporting to individuals about what benefits and the amounts of the benefits that they use.
Okay.
So, like over the counter medications, you have to send a report to them saying you have fulfilled this many orders, you still have this amount left. And so they have to basically send them a usage report to try to encourage them to use these benefits.
Do you think that will lead to less and less benefits having the ability to be rolled over? Because I feel like if you just saved it all in quarter one and then we're going to use it all in quarter two, that would show not as well as usage. So maybe carriers would step away from like, oh, you'll save that benefit going into the next quarter.
I don't know necessarily about the rollover. I do know that this is additional administrative costs
Okay.
to the carriers to one have to actually
Track
track it, and because they're tracking it anyways, but one encourage people utilizing these these services or keeping them in front of them. It's in the carrier's best interest if they don't use them in a lot of these cases.
Okay.
So I do think it's going to be an additional burden of the carriers to one, notify the consumers, two, do it in a way that makes sense, and three, for people to use those benefits. We do see a lot of carriers. It is very rare nowadays that I love this. It is very rare nowadays that MAPD plans will have benefits that are not going to be quartered spaced out.
Okay.
And that's mainly because they're afraid of AEP's rapid disenrollment. That they don't want people to start in January, February, to get dentures, use these benefits, max out all their stuff, and then change immediately because there isn't the income from CMS to offset those costs. So it's normal now that you do see quarterly that don't roll over just because to help with the estimation of costs.
Gotcha.
So it is going to be something that we continue to see, but just understanding that carriers, not only did they have the IRA that's going to impact their mind, but they're having to come up with a lot of administrative systems and processes they hadn't had to do in the past.
Yeah.
What a boring subject. I promise there's cool stuff. Another significant thing that we're going to see come into play is the end of agent-assisted enrollment for the disaster SEPs. So a disaster SEP, we're seeing them right now coming in from California. We actually just had one for Missouri. They've gotten out of control. When I first started in the industry back in 2013, this wasn't a thing unless it was like
2013.
I said that right?
No, I just was.
I was gonna say I said that right. Yes, in 2013. You're making me feel old. You're doing that thing again.
I would know.
Where you remind me that we're not the same. But this wasn't a thing. It became like really common in the last 3 or 4 years to where a disaster happens. Sometimes like a real disaster, like the California wildfires. Other times, more likely, this one was the Missouri for bad weather, which is cold weather. We got an SEP for that by some carriers. What that means is that you can just enroll. You can say, I didn't get the option to enroll into a plan because the weather was cold, so give me an SEP.
I remember hearing one of the most strangest ones was like someone passed away in Georgia, and they were like, because they passed away, we've created an SEP because you couldn't, get out of your house. There was a lot going on.
You couldn't survive because this individual had passed, and
it was someone famous, I'm sure, but I don't know the difference between the tortellini and whatever,
and you married an Italian woman. I'm sending this to her immediately.
Oh no.
So anyways, what this is saying is that we as agents, the election period will still exist, but it will be a direct to Medicare enrollment, and I believe that starts in April. That takes place. So when you're seeing these disaster SEPs, you have basically quarter one to go ahead and utilize those disaster AEPs. After that, it'll still be there, but the consumer will have to call 1-800-MEDICARE in order to be able to utilize that SEP. I imagine that it will also mean that you will see less SEPs coming out because the carriers won't be as incentivized because they're not, out there in the open.
The best wording that I've seen help kind of bridge that gap was kind of view it as the low performance star rating SEP from that point forward. So after that plan hits the, third year in a row of 2.5 stars or less, then that client now has the ability to go direct to Medicare to get on a different plan for low performance. That just writes the agent out. And that's what this SEP, disaster is switching over to.
Terry said he could barely hear me. And Terry, I apologize because that's never been a problem for me to not be heard. We're again, for everybody who this is your first time joining, we are trying a new setup. The studio is going to continue to be enhanced, continue to look different, but I'm trying to learn how to eat the microphone because I'm a hand talker. Okay, so that was probably very
I'll just
unpleasant for
hold
most
it and
people.
just try to
Just follow
track
me.
it.
I need this, but like, can you imagine this, but like on a headset?
That'd
Like
be
not like this size,
a
but
heavy headset.
well, listen, I have a strong noggin. Anyways, I don't
Give
know.
me some fin. Noggin.
Dude. Okay.
Dude.
Next, so again, the disaster SEP going away. After that, a lot of M3P questions. The Medicare prescription payment program. Remember that was part of the Inflation Reduction Act that got into practice this year. One of the major reasons why carriers were flipping out and why so many of them fled the PDP market, going to effect now. Our stance at Senior Marketing Specialists, we've actually partnered with several different firms that's kind of been keeping their thumb on the pulse with this. In fact, we actually here in Columbia, Missouri is just a tiny town in the middle of Missouri, right between I-70 and not right between St. Louis and Kansas City on I-70. And we actually, in our hometown, have the firm that is going to be putting into practice the M3P, like the firm who is going to be foreseeing all the administrative work around it, is also in Columbia.
Yeah.
So we had a meeting with them about a month ago and just got some insight from them about what they're thinking, what they're seeing the implications of this being. And essentially, it's just like the number one thing they're struggling with is getting information on how to enroll into it.
Yeah, I can imagine. It's probably rather difficult. I know we've been able to find some of the stuff and part of the stuff that we're trying to make available, but one, not only is this new to clients, but this is also extremely new to carriers.
Yeah.
We are all in kind of this pool of uncertainty.
Hey, what's going on? That's where we're all at on this point.
What's going on?
No, you're still wrong.
Oh, my bad.
You're not in my brain, and that makes you wrong.
Okay.
So what we're hearing from Senior Marketing Specialists with your advisors and our partnerships is basically saying that your client should be looking at the M3P as an option to them if they're going to hit their maximum out of pocket within the first quarter. If they're not hitting that maximum out of pocket within the first quarter, it's likely that the M3P is not going to benefit them, at least not to the same degree as others. So just keeping that in mind, carriers are not... They have to have the program available. They're not making it easy to enroll into because, again, of the administrative burden and the financial burden that puts on them is not in their best interest if consumers enroll in this program more times than not. And the pharmacists are honestly at this point incredibly uneducated and unfamiliar with the program as well. So we're going to continue to see a lot more education come out of that from the carriers as well as CMS, but understanding that CMS does see it as the burden of pharmacists, providers, carriers, and agents to educate your clients. So making sure that you're staying up to date with what's going on because that will continue to be a point in 2025.
On the bright side, whenever we see some of this like hiccups or spookiness, it does create a lot of opportunity.
Yes.
So you as an agent, definitely find your local pharmacist reps, pharmacies that you use, either pharmacies that you know that a good amount of your clientele use. The more you can inform and get things in front of them, the more that they will, sing your praises to people that are maybe not already set up with you. So that's a huge sphere of influence that I like to kind of view at. So if you're an agent that is trying to figure out where's my next client over the next 6 months is coming from, take some time and sit down and look at those pharmacies.
We actually do even have PowerPoints that are designed to go over the Inflation Reduction Act and the M3P. So if you're interested in doing like a lunch and learn or just a base of education, that is a great place to start because people are frustrated by the lack of information out there. So great point, Ben. Just a way for you to be like the leader of your community and what this is going on. Couple more things I want to talk about. Crazy 2026 AEP for a lot of the reasons that I already talked about. Understanding it already announced the PDP maximum out of pocket for 2026 will be $2,100. So just setting the expectation that is one that will be going up year after year, similar to our other types of maximum out of pocket, similar to what it was back in the day. But just understanding that 2026 AEP is going to be another one for the books.
Remind me, is it the base beneficiary benefit that goes up by 6%?
Yes. So a great point to that. Just a reminder if you guys, again, forgot because a million things have happened since our AEP prep webinars and today. A lot of people are saying, well, the PDP premium, right now they're locked in because from last year going forward, they're only able to increase the premium by 6%. So PDPs, we really won't see a ton of change in 2026. That is wrong. Understand that 6% increase in premium that Ben's referring to in that cap is only the base beneficiary premium, which is basically how they determine low income subsidy thresholds, the Part D penalty threshold, things like that. That can only go up 6% year over year. There's nothing that's stopping your Part D premium if I'm going up more than 6%. So just understand that one thing I want to mention about why 2026 we're expecting it to be another crazy AEP, it's never too early to AEP prep, is because a lot of carriers got it wrong this year. A lot of carriers came out of the gate in 2025 AEP being way more or way less competitive than they thought they would. They knew every company was going to have significant changes. Every company was going to have to cut in certain areas and invest in others. And so they were trying, and every carrier kept it really close to the chest. No one really talked about what their benefits, where they were cutting, in a way that was going to influence how other carriers were going to put out their product. October 1st, everybody put it out on the table. Some carriers were not prepared to win big.
Yeah.
Other carriers were not prepared to lose and lost big. So you're going to see a lot of corrections in 2026 to recoup to recoup that business and to help with their health of their business for 2026.
And correct me if I'm wrong, that's why we
usually
saw true. And I appreciate that because it's very helpful. That's why we saw a lot of those plans go like e-app only, or
Such a great point.
trying to figure out exactly what was the best style for them to stay in a place of comfortability for the carrier while still servicing a certain number of clients.
Yes, that's exactly why we saw a lot of carriers go non-commissionable in some cases, in some extreme cases, or just e-app only. And hopefully those corrections would bring back commissions in some cases, in a lot of cases, not all, and would make them so they're e-roll friendly.
So I'll say this here. I'll fall on the sword. Any agent who's listening to this needs to be aware of electronic applications from this point forward. One, it'll help your systems, but two, if a carrier views e-apps as a way to limit enrollment, it means they know that agents don't like e-apps. So take that off the table. Get familiar with that style of application and submission process. That'll help your system, and also give you access to a lot of the carriers that may not want to work with paper any longer, which I know we are quickly getting to that spot.
We're seeing a lot of carriers who have tried to come out with no paper and quickly revert back to paper. And I just think you're going to continue to see that push.
Yeah.
You're kind of seeing the entry of it. But we also know, again, agents, when you look at the Medicare Center stats, the agents who are using Medicare Center write like 5 times the amount of apps compared to agents that don't.
Very true.
That use paper methods or any other methods. So just something to consider for sure. The next thing, just really quick to wrap up here in the next couple of slides, conversations around negotiated drugs are continuing. Obviously, the number one negotiated drug right now are going to be Ozempic and any other medications that are associated with weight loss. There has been a lot of talks about getting these types of medications approved and having them approved on a Medicare level to where, like, to fight obesity, we obviously know obesity and weight gain will affect mental health, will affect vision, will affect a lot of other things that go to overall health. And so there is a huge push right now of getting those medications. Obviously, due to the Inflation Reduction Act, we do know that there was a list of 10 medications that are being negotiated that will go into effect in 2026. We'll continue to see those, but just knowing that you're going to hear a lot more information about these negotiated drug prices, Ozempic and another weight loss one.
And that's
one at the top of that list.
That's one of the ones that they negotiate that list every year, correct? They are continuing to readdress what drugs are either being used or need to be negotiated at certain prices.
Exactly. So more to come on that, but just knowing that the Inflation Reduction Act is something that is actually being staged into until 2035 is
Wow.
when we see the end of basically everything that's putting into the Inflation Reduction Act. Understanding that the new administration, the Trump administration, can change that. I mean,
True.
that was something that was put. The IRA was put in by the Biden administration, so the Trump administration can come in and reverse some of that. Not likely to reverse all of it, but we can not expect to see, but it wouldn't be surprising to see some changes to the Inflation Reduction Act going into this new administration.
At the very least, conversation surrounding it, and where does that conversation usually happen on TV or whatnot? So you may be getting questions from clients because of this new administration change,
Yeah.
and so just be prepared for put out some of those
Yeah.
uncertainties, or hey, I saw this. We see it all the time.
Yeah.
The biggest time of change, especially with the inauguration just happening yesterday, I believe it was, these things are going to start circling around more and more. And so definitely something just to kind of be preemptively aware of.
Yeah, you're gonna hear. There was also a bunch of excuse me, a bunch of legislation basically going into the budget and what's
Gotcha.
going on with the budget. And there was proposed significant cuts to Medicare on that budget. There always are.
Yeah.
It's a quick way to look and get people's attention and get people riled up. That by no means anything is actually going to happen that's significant to the Medicare budget, but just know that it was proposed for some significant cuts, and we can expect that it is every single time, and it is in everybody's best interest. Everybody is in a politician's best interest to make sure that their names aren't put on significant Medicare or Social Security cuts. So. I do want to answer a couple questions. One was from William a while ago. I think he also texted me. Does that mean that the cutback on DVH as well? I'm assuming that you're talking about the first conversation about the changes to those bells and whistles offered by certain plans for those who qualify via medically or qualify via income-based. Oftentimes, yes, dental, vision, and hearing is included in those. In those style of plans who receives the majority of their funding from CMS, yes, it is likely that you'll see. Most notably, though, you're talking about like food cards, transportation benefits, over-the-counter medications. In some cases, you're talking about like cell phone bills, Wi-Fi bills, to those who are on low-income benefits. Basically saying that like they're unable to point a line to like how that helps you medically, or just saying that like there's not enough evidence to say that those people saw the doctors less than people who did not receive those benefits.
I wonder if there would be a case study or an argument made for
There's always an argument to make.
the fitness reimbursement that we had over the past year and a half.
Yeah.
If someone did partake in that and actually reimbursed, something that helped keep them active, if they could actually, put into place, hey, this benefit did actually keep people more active. So it'll be interesting to see how they track that. I'm sure it'll be expensive to try to track the relationship between, hiking shoes and then
I think it's just,
not going to the doctor.
There's so much burden of proof. For a good reason, you're talking about government dollars.
Yeah.
There needs to be proof that what they're doing is working, and it's not just getting enrollment without actually translating into, healthier seniors. But there is a lot of burden of proof that relies so heavily too on reporting back to the carriers. And saying, that's why like we're talking about like these fitness watches. Like mine just went off because I've been sitting for too long. Get off my back, Apple. But like there is a burden of proof of like allowing my information and my activity level and what I'm doing with that to be shared back to the carrier, that I just don't know, that the carriers have the administration for it, have the administrative capabilities for it, and B, that like today's seniors trust anybody enough with that information.
That's exactly what I was going to say. Even if they had the capability to do it, do they have the clientele that would be okay with that, being a conversation that they have?
But it would be wildly interesting. I mean, I think that's why so many carriers are going towards like the fitness watches, is saying like we want to see how active you are. But yeah, and like Brittany said, especially for extras for the dental, they throw in like where you can use dental on a Visa card. Exactly. Like it's getting more and more difficult with all these like lackadaisical, you can do this, you can do that. Again, like Aetna last year had their fitness reimbursement that it would pay for golf clubs. Like, or pay for shoes even. And like you just had to turn a receipt that you went on a walk at a park or something, like, and or take a picture of you on a walk. Like, it's just, great ideas, great concepts are super helpful for the individuals who utilize that,
Yeah.
but also can be super detrimental to taxpayers' dollars that are paying for somebody's new shoes. So depending on what side of the aisle you are on, definitely different perspectives there.
Be very easy to look at that depending on what was purchased and say, no, get rid of it, or yes, keep it. So very gray.
So much gray. Mary said, how do we advocate for companies to be required to pay commissions on all plans? Is that a request into CMS? It's not a request into CMS. CMS is designed to to work with providers and the insurance carriers. In fact, CMS, for a while there, we're trying to prove to CMS that agents had a place in the enrollment process for carriers. If you're wanting to advocate on behalf of agents to only write plans or have all plans to pay commissions, number one, your business speaks. If you're going to continue to write business for carriers that don't pay commissions, there's not a lot of incentive for the carriers to change that. Also, understanding what is the carrier saying by not wanting to pay you commissions, but still offering a competitive plan. Having how to have a conversation with your client about why that plan may not be in their best interest if they're not valuing you as an agent. But also working with your organizations like NAFA, NABIP, your local organizations that speak to the carriers, speak to legislation on your behalf. CMS is, joining those organizations is going to be better than trying to talk to CMS about getting agents paid.
Yeah.
So it is frustrating. It is frustrating. But again, your business talks. If we continue to write business for plans that are non-commissioned, then I don't really expect to see that changing anytime soon.
They still have the numbers of enrollment, so they don't see that anything needs to change.
It's way cheaper for them.
Yeah.
Agent commission is a tremendous amount of money. Keep in mind, whenever a CMS or whenever a Medicare Advantage company makes a Part C or Part D plan, 80% of the income they have generated from that plan, either from CMS or otherwise, has to go back into that plan. Mm-hmm. So they have to pay their administrative costs, they have to pay their CEOs, they have to pay for everything else, including, again, the employees, your calls. They have to pay for everything else out of that 20%, which includes agent commission. So it's cheaper for them if they don't have to pay you. They get to use that money elsewhere that doesn't have to go towards the benefit.
It'll be interesting because we talked about it earlier, with the increasing amount of administrative work responsibility that's being put on the carrier. Where will straws have to be cut, or strings have to be cut?
A decrease in income, a decrease in benefits that they got, a decrease in oftentimes membership that they got this year, an increase of administrative costs, and the increase of costs due to the IRA and having that $2,000 MOOP. They're having to find it with money elsewhere. I'm not saying that we'll continue to see more plans go non-commissionable. I'm not saying anything like that. I do think that several carriers out there have made a very strong stance to stay with their agents. Cigna's been one of the loudest with that. United Healthcare, it's been really loud with that. Aetna MA has been really loud with, wanting to stand with the agent, as well as several other on the local level as well. Mm-hmm. But carriers who have not been loud, their actions followed. So just continue to kind of pay attention to that.
Yeah, no, I'd agree.
The last thing I wanted to talk about were Medicare supplements. We are continuing to see massive rate increases across the board for Medicare supplements. Expect to see that throughout this year and probably for the next couple years until the market self-corrects or corrects itself with that. We're also seeing a lot of people, because of the Medicare Advantage tumultuous, termaculate, because of the upset in the Medicare Advantage space, we've seen a lot of people flee back into the Medicare supplements, and they did so via guarantee issue because of so many service area reductions, so many different changes. People went to MedSup, and the thing that will kill Medicare supplements faster than anything else is guarantee issue business, and we saw a surge of that. So we're going to continue to see the Medicare supplement market try to correct itself. You're going to continue to see some Medicare supplements. If a company was dabbling in Medicare supplements, you're going to see them pull out. We've seen that happen, Lumico being the most recent in a lot of areas. Yeah. You can continue to see those smaller carriers, those dabbling type carriers continue to pull out the MedSup market. MedSup is still a tremendous product for your clients, just understanding that you're selling something that's just more luxury than it used to be.
When there was a lot of change on one side, it drove a lot of traffic to the other, all while where the traffic was being flowed to was trying to get a firm foundation underneath themselves. Because from my understanding, we were still trying to right the wrongs from T65 rates over the past
Yes.
10 years
Yes, that
before
we
I
just did
even
not
knew about Medicare.
Exactly. We didn't see premium increases on those. So not only are you trying to account for 10 years of inflation
Yeah.
that was not reflected in those premiums, then all these other changes. Sorry, you're saying, and I just hadn't
No,
talked for 30 seconds.
no,
and it
that's
bothered
perfect.
me.
It was heightening the idea. That's what
Mhm.
we do here.
That's what we do. Just let Olivia talk and let Grandma talk until she talks about her.
I'm
old
learning
days.
just as much, and I hopefully everyone on the interwebs is doing as
The
well.
internet machine. Can I tell you? Okay, that's what we have today. That's the end of the cafe. That's the things we want to talk about. I do want to talk about Sadie's here. Hi, Sadie. You wanted to come in quiet, and I said no. I do want to talk about something that I have a pet peeve right now that has nothing to do with Medicare, but I just got an invite and it annoys me. Tell me what you guys think, because this genuinely I want to know. Because if it is a good marketing tactic, we'll start doing it, but I'm mad about it. When people send you an invite to a training or to like a webinar or something because they're trying to gain your business as people who I don't currently work with, but it's like learn how leads can generate you, whatever. They send me a calendar invite with the link. So I have to go in there, and instead of just saying like, do you want to sign up for it? Click it to sign up for it. They put it on my calendar and I have to actively say, no, I don't want that. That irritates me. Am I just a psychopath? Is that annoying for anybody
No,
else?
that's valid. I feel like that's an assumption that you want to work with me
Which
instead.
that's like sales. Sales, you assume the close. You
Yeah.
assume the close. If I'm going to sit here and talk to you, I'm just going to assume you're my client. I'm going to give you the application. We're going to move forward. That's what sales. So I understand. I can see the art behind it, but I'm annoyed. I don't want to have to deny you.
It incites an extreme reaction. You either get an extreme, no, I don't ever want to do that with them ever again because of this assumption, or wow, they put it on my calendar. I can make sure I'm going to be there. So it's like maybe you get rid of the,
How many people though are just like, maybe there is some passive of just like, well, it's on my calendar. This must be something I should be going to. Because if it's on my calendar,
I don't know if you guys can hear me, but I schedule the the training stuff, and I've had people reach out to me and ask if I could just put it on their like calendars. And our systems don't allow us to do that,
No.
but I've had people request that of me before.
but that was audibly displeasing. Can you
Or
guys
really
tell me if that's what
satisfying.
you want? If you want us to go on there and actually assault your calendars and put these links on there, I view it as an assault. It's like when YouTube put music on and I love YouTube, but it's like when YouTube went pre-downloaded music to my iPhone. That's awfully assumptive of you.
yeah, I don't even know who U2 is. So, and I still have some of their music.
Bono?
Guys, look,
God,
I
we are
can't take
from a
another
different
one.
generation.
Okay.
Anyways, if you guys have thoughts on that, shoot me a text. If you guys are just like, no, it'd be really helpful if you
Not
guys...
on me not knowing U2 about the
No,
calendar.
also on him not knowing
No,
the
no, no,
difference
no,
between
no.
a tortellini and... Anyways.
Say tortellini 5 times fast.
Tortellini. What's that?
Or once really slow. Okay, that's fine too.
Awesome, guys. Appreciate you all hanging out with us on the Medicare Cafe
It's the
today.
period this time.
It's the period?
For the end one.
Why do
I
you...
changed it
Come
on you.
on, my guy.
I knew I was going to be made fun of, so I had to have the last laugh.
I get it. Oh, we appreciate you guys. Make sure you join us on Facebook. We have a closed agent group where agents can get together, drink Java, and talk shop. Hopefully you guys are liking this new format. We have a ton of additional changes to be expecting throughout the year, but especially in the first quarter leading into Medicare Cafe. I do want to let you guys know, we are getting ready to post everything about this, but we are hosting a Medicare Quick Start in-person class on February 20th here in 803 Gray Oak Drive, our Columbia location. So we will likely be offering a virtual, like basically sit down, a virtual version of that as well. But we will be having our training open, our training studio open over there. So you can sit down, listen to me, as well as we'll have other individuals. Sadie will be there. We'll have most likely Chaylin. Ben will likely make an appearance. Just helping you guys prep for 2025. So the Medicare Quick Start program is just if you want a refresher, if you're an active agent, you want a refresher, or you're bringing on downlight or admin, or you're somebody who's brand new and wants to add Medicare to their quill, then this is a great quiver. The quill goes in the quiver.
Quill is right.
Quills are
Quiver
right.
is arrows and bows.
What does the arrows and bows go into? That's a quiver.
Yeah.
Backpack. It'll into your fancy backpack. Douglas says I need to talk with you. I hope you're not HR, but if you're not, then yes, we can talk. Again, that is myself. Shoot me a text message, or if you want to talk to the main office here at Senior Marketing Specialist, somebody like Ben, or someone who's just like, I just need to learn how to work better with your team. Our number is 1-800-689-2800. 1-800-689-2800. And that'll get you to our office. Anytime you call our office, a real person answers the phone. We do not have machines or a triage system because I don't know how to work them. So feel free to give us a call. Talk to Ben. He is somebody who can get you set up well. Sadie, what else do I have? Mary says, will a link be sent out for this? I like this. I want to touch. Will a link be sent out for the quick start to share with the others? Yes, it will. We will send you a link. You will like it. We won't put it on your calendar for you because I take offense.
Unless you want it on your calendar, then we can talk. Nonetheless, I know there's a lot of people in here that I work with specifically, and I know you have growth in mind. So I better see you on February 20th.
We're doing this a lot. I like that.
Look, you were touching the mic, so I went visual.
Until next time, guys. Have fun.
Make money.
And give impeccable service. Thanks, y'all.
Bye.